everyone. Welcome to the Health Priority Podcast, where we empower you with reliable, engaging, and practical insights into health and wellness. I'm your host, Anita Dankwa, and in our first episode, we will be diving into a very special topic that can literally save lives: cervical cancer. So, joining me is a very special guest, Dr. Kelly Nanapoko, who is a medical doctor and also somebody who is passionate in women's health and also a co-founder for Cervical Foundation, a non-profit organization that focuses on creating awareness and educating communities on the prevention of cervical cancer. It's incredible to have you here today. I love how you've initiated a foundation to create awareness on cervical cancer. But I would like to ask you what inspired you to start this foundation and why the focus on cervical cancer?
Okay. Thank you very much for the question. And once again, I'm privileged to be here to share with you all. So, Cervical Foundation started, well, at least the desire started sometime back 2 years ago, during my 5th year in medical school, during my ops and gynae rotation. So we were on ward rounds with our consultant. Then we got to a patient who obviously looked so much in pain, and she was finding it difficult to breathe, okay? And it was such a sad sight to behold, someone's mother struggling to breathe and was in pain. Then our consultant told us that she had metastatic cervical cancer. That means that her cervical cancer is in the late stages, and so it has spread all through her body.
So for how long was this patient diagnosed with this condition?
I really don't remember, but what I remember is that she presented late, okay? She presented late when her symptoms had gone far beyond medical help, okay? I think she presented with abnormal vaginal bleeding, and by the time they conducted all the investigations, she had the cancer had spread, and unfortunately they couldn't do anything but just put her or give her palliative care. Palliative care means, well, the patient is eventually going to pass away.
Or how many months, weeks?
The patient, so the patient with palliative care, the patient is eventually going to pass away, but the doctors try as much as possible to make them feel comfortable. So they give them pain meds, IV fluids, anything at all that is the body needs to be comfortable.
So just to manage the pain so the patient passes on.
Yeah, and that was very sad. And unfortunately, I think the next week we came and she had already passed. It was very, very sad. So the ward round turned into a conversation.
Was she the only patient diagnosed on that ward?
No, but she was the one that I saw, and the state that she was in really touched me. That was the story that really gave me, the inspiration to start this foundation. Yes. Yeah. So yeah, basically.
So the patient wasn't bedridden.
She was.
She couldn't move.
She couldn't move. She was in pain. She was struggling to breathe. There were nasal prongs in her nose to help her breathe. She was really, really suffering. You could see this old woman was suffering, and it was very sad.
That's really a sad story.
Yeah. So I just decided to start this foundation, because I believe that you should be the change you want to see in the world. Yeah. So I decided to start this foundation to create awareness that there is something called cervical cancer. It's very, very treatable. It's very, very preventable, only with early diagnosis. So I wanted to create awareness on that, and of course, partner with health institutions, corporate organizations, and anybody that is interested in making sure that we reduce cervical cancer burden in Ghana. So cervical cancer refers to abnormal growth of cells on your cervix. Okay, so your cervix is the connection between your womb, that is your uterus, and your vagina. So cervical cancer refers to abnormal growth of cells on the cervix of a female. that is cervical cancer. The main cause of cervical cancer is the human papilloma virus, that is the HPV virus, the wild type or the high risk type, that is HPV type 16 and type 18.
Also, we have. So, is there a difference between that H type of HPV, the 16, and the other you're talking about?
Not really. So there are over 150 types of HPV
Or there
virus.
is like a connection between.
No. So there are over 150 types of HPV viruses. Some cause vulval cancer, throat cancer. They cause different kinds of cancers.
Okay.
However, it's the HPV 16 and HPV 18 that have been associated with cervical cancer. So studies and research have proven that they cause cervical cancer.
So, the HPV virus that causes the cancer on the cervix.
Yes, exactly. So it's infection. So basically, it starts with an infection with the virus. And the virus
Okay.
is very common, actually. It's sexually transmitted. So averagely, like a normal person who is sexually active will encounter this virus at one point in time in their lives. And most of them, see, I told you there are over 150 types. Most of the viruses are harmless. So you get infected, your body fights it, if you are fit and everything, okay. Your body may fight off the infection if you are healthy. However, when you keep getting infected with the HPV 16 and HPV 18 virus, then over time, the virus sort of causes abnormal cells to grow on your cervix. And when these abnormal cells grow on your cervix, it takes a period of 10 years to 20 years for the abnormal cells to develop into cancer. Okay, so persistent infection with the HPV high risk virus, that is HPV 16 and 18.
18.
Yes, over time, the abnormal cells that develop on the cervix due to the HPV 16 and 18 persistent infection
Okay.
would develop into cervical cancer. But this is a slow process, it takes about 10 to 20 years.
So, to get you persistent infections
Yes.
that cause the HPV 16 and 18,
Yeah.
leading to the cancer.
Yes.
Oh, okay.
Yes. So the persistent infection will lead to abnormal cells on the cervix.
On the
And these
cervix.
abnormal cells will take 10 to 20 years to develop into cancer.
Oh, so if I get it, maybe probably I wouldn't know, and I'm 20,
Yeah.
and let's say I'm 40 years, and I start experiencing. What are some of the symptoms that I get to?
Okay. So the symptoms, the most common symptom is abnormal vaginal bleeding. So
Okay, so what
yeah.
that means when I'm 40 years and I start seeing this blood, is it
Yeah.
just the blood?
Yeah, so as I said, abnormal vaginal bleeding. So any bleeding that is outside of your menses. So
Any specific color?
yeah, oh, it could be any color, but it should be most of the time the patients that present to the hospital, they usually have postmenopausal bleeding. That's one of the main
Okay.
findings. So they have menopause, so they should not be menstruating or they should not be seeing blood. But then they come to the hospital because they are still bleeding. Some people think they've entered into their menses again, but that's not it. It could be cervical cancer. Another type of abnormal vaginal bleeding is bleeding during or after sex, because you shouldn't be bleeding.
So after 40 years, when
After
I'm having intimate with somebody and I'm bleeding.
then you are bleeding. It's a danger sign that you should visit
So for
the
the
hospital.
whole 20 years,
Yes.
later that was 20, so
yeah.
I was 20 years, now I'm 40.
40 years,
I
then you
wouldn't
start
know
seeing.
the symptoms
You wouldn't. You'll be
till
fine.
I'm 40 years.
Exactly.
So
You'll be
either 10 to
fine.
20 years before the virus starts to manifest.
Exactly. You would be. That's the thing about cervical cancer. You'd be fine. You'd go about your normal activities, but then damage will be done to your body, and it will show up in the next 20 years. And usually, when these signs show, okay, very little can be done for such people. Now, let me continue with the symptoms. The abnormal vaginal bleeding. Another example is any bleeding outside of your menses. So you know your menses, the flow and everything. You know, oh, I bleed 5 days. I bleed 1 week.
But how will I know it? Because I know that people spot before menstruation and
Yeah.
even after.
Yeah.
So when I'm 40 years, maybe I'm 20, then after 40
Yeah,
years, I'm
40.
40, I see spotting.
Yeah. How would you
How
know?
do I know that, okay, that's like a symptom of
I get
cervical
you.
cancer?
Okay, so once again, symptoms do you see abnormal vaginal bleeding can be a symptom of any cancer at all. It could be of ovarian cancer, it could be of
Maybe a cat.
yeah,
A
exactly,
cat, yeah.
anything. So basically symptoms mean that when you see this, go to the nearest hospital, let them confirm, let them make sure that
Okay.
you are okay. So definitely if you see abnormal vaginal bleeding, that doesn't mean you have cervical cancer. It just means that you may be at risk, so you should see your doctor about it.
But I think I have women who are past their post
Their menopause.
their menopause, but they are still bleeding.
Yes. So that bleeding, once again, if you know you have menopause, you're postmenopausal, you should not be bleeding. I advise that you go to the hospital just to confirm that it
It's
is
not
not
cervical
cervical
cancer.
cancer. You are fine. It could be normal. It could be another thing.
Okay.
Just make sure you're
Just to
fine. Exactly.
okay. So
Yeah.
during my research, I read that screenings are uncommon here in Ghana.
Yes.
Why is creating awareness such a challenge here in Ghana?
So the reason why awareness, screening, vaccination, the reason why it's really low in Ghana is because there are no national campaigns, okay, dedicated to specifically creating awareness about cervical cancer.
Are you
Yeah,
are you telling me?
I personally, I haven't. We all have witnessed October, Pinktober, how
Okay,
people make
yeah,
so
so
much
much
noise about
noise,
breast cancer.
mental health,
Exactly. You go around, you
yeah.
see pink ribbons. Everybody.
But generally, I don't see the. What's your
Exactly.
color for the
It's
cervical?
teal.
Teal.
People
Yeah,
don't
I
even
don't
know
see
that.
people wearing.
Exactly, the
We
teal
don't have
ribbon.
events even
Exactly,
on.
dedicated to that. So it's just about people, like that much attention is not being paid to cervical cancer as much as breast cancer or any other
Yeah.
issues that women face.
So
So I
that
believe
that
that's
means
one of the
that
main
the
contributes.
big
Yeah.
hospitals also are not putting much information out there or what?
I guess once again it's a collective responsibility.
Okay,
So
yeah.
the government, these big hospitals, even individuals.
Yeah.
So that's why I have started this foundation. I'm just a concerned citizen who
Yeah.
wants change, and
And only
I did
you
something
can't
about it.
just make that
Exactly,
impact. Yeah,
exactly.
a
So
lot of voices can be heard out there.
exactly,
Oh, okay.
exactly. Yeah.
So aside the lack of
Yeah.
awareness
Aside
out
the
there,
lack of awareness.
aside the we don't have the national um program thing that you're talking about. Okay, yeah.
Yeah.
So aside that, is there any other
Yeah.
hindrance to that why we are not
We are
creating
not creating
awareness
aware.
on?
Okay. So another hindrance, this one is not mainly on the awareness. So with the awareness, the main issue is the fact that much noise is not being
Yeah,
made
make
about
it
it. But for
answer.
the others, that is the screening and the vaccination. The screening there are very few screening centers, and these screening centers are usually available in regional hospitals and teaching hospitals, and very, very few private facilities. I know Mary Stopes, they also do cervical cancer screening and vaccination, and honestly, that's the only private clinic I know personally that
Okay.
does that. So you can imagine a woman who finds herself in a village somewhere in the eastern region, okay, who may have heard of cervical cancer or something and would want to do something about it, but she would have to travel all the way to a regional hospital in the eastern region to get access to these screening.
That's Mary Stoops.
Exact.
So in the government side, we do not have like these government hospitals do not have access to like kits to offer screenings for these women.
Okay, they do actually. It's just that they are limited to regional hospitals
Oh, okay.
and big teaching hospitals. Basically, these big hospitals. They are not the kits or the screening kits are not usually made available in these rural areas. And even if
Okay,
they are made
yes, in
available,
the rural
yeah,
areas, okay.
it's not much. So I believe the poor or lack of availability of the screening kits and also the vaccination, okay, the lack of availability about the screening and the vaccination also makes it very hard to create awareness,
Okay.
about cervical cancer. So I believe these three things: the poor,
And the vaccination, is it expensive? The test kit.
yeah, it
I think
is.
I saw a test kit that um I think we can do that. I can personally buy the kits
Yeah.
and do that in the house.
Okay.
Is that really expensive, or still it's not provided at the pharmacies for us to buy or something?
Okay, so I think the one you're referring to is if I'm right, the VIA kit. So that one is quite is easy to administer and it's very affordable as well.
Oh,
Yeah.
okay.
So with that one, that's one thing that even the WHO is trying to roll out in these low income countries. So they are trying to make available the VIA kit.
Okay.
It's very affordable. I think once again, the last time I checked, there was 65 CDs
Oh,
at Marie Stopes. I don't know the price now, but it's very affordable. And
yes.
also, the women, or you can sort of take a sample by yourself.
Yeah.
Do you get it?
Yes.
And then go to the hospital.
Oh,
So
okay.
the kits, the VIA kit is readily available. But once again, most people do not even know that these things exist. So yes, the screening tools are available, the vaccinations are available, but they are just not that accessible to people.
Let's talk about the symptoms again.
Okay.
I
Yes.
know you said that most of the symptoms do not appear until you are in your late, like 10 years to 20 years before you see the virus starts to manifest before you see it. But before that, so you don't see any symptoms come, probably
Yeah.
let's say headache
So, as I said, because of the slow progress of
the
the disease, most
virus.
people are asymptomatic. And the common symptoms, as I mentioned, is the abnormal vaginal bleeding, but they can also present with lower abdominal pain. Now, you see, women, we usually have pain all the time. Like during
Yeah,
your menses,
yes,
your
yes.
abdomen is hurting and everything. So, most women may blame it on their menses. That is, if they are not postmenopausal and they are um, getting their menses, they may blame it on their menses and ignore the fact that it could be a sign of that. I'm not saying
Yeah.
every abdominal pain is cervical cancer, no,
Oh,
but
yeah.
any pain that you feel like may be out of proportion, is not expected, it's not your usual pain, I think it's best to see your doctor about it. So apart from the abdominal pain, when the cancer progresses, okay, sorry, you may also have vaginal discharge. So women, once again, we have
Yeah, we have
normal
our
vaginal
discharges
discharge,
start.
but any vaginal discharge that is sort of out of normal for you, so it's
Do we have like
offensive.
a
If
color?
yeah, if it's offensive, if the color is different from what you usually experience, if it's a lot, because discharge should not be a lot. If it's a lot, if it's bloody, if it has blood in it,
Yeah.
all these things, you should see your doctor about it to make sure that you are safe. And then when the disease has progressed, that is, the cancer has spread, you may have signs of weight loss. So people come to the hospital and what they present with is weight loss. I'm eating well.
But
I'm
I'm
not
not
trying to
gaining the
lose weight,
weight.
but I'm losing weight. So weight loss, they may have fatigue, so they easily get tired. They are tired all the time. And sometimes they may have edema, that is swelling. So their feet will start swelling, their arms will start swelling, sometimes their face. So when you start seeing these things, it means that the disease has progressed and you need help immediately. So these are some of the main symptoms of cervical cancer. But because of the fact that it's usually asymptomatic, that is why screening is important, because if you do regular screening, they may find it in the hospital. And the good thing about it is that if it has not developed into cancer yet, if it's in that 10 to 20-year
Yeah.
period that I'm talking about, you can be cured. There are certain procedures that can be done for you to take out that abnormal cell,
So,
and then you'll be fine again.
okay.
Exactly.
So, like, how serious is this? I think
It's
we can talk about the statistics
yeah.
now so that people be aware that this
Yeah,
is really serious.
it's really serious. So I mentioned somewhere that every year in Ghana alone, right, over 2,000 women are diagnosed with cervical cancer in a year. and 50%, that is half of those women, will lose their lives to cervical cancer. Something that is very preventable and curable at
Is
the
it
early stages.
so? These 2,000 women,
Exactly.
is it like from both the urban and the rural?
Yeah, when you sum up all the cervical cancers cases, both the urban and then the rural women, they make up over 2,000.
I know cancer is cancer.
Yeah.
If it spreads, there are treatment for it.
Yeah.
But like you said, your story, somebody was placed on palliative care
Yeah.
when it gets to the last stage.
Yeah.
Now let's talk about the treatment and prevention.
Okay.
So let's talk about the treatment first, because
Okay.
people might think that, oh, if I get a cancer, yeah, it's probably treatable. So
Yeah.
if I'm being placed on the chemo, I'll be cancer free
I get you.
yeah. So let's talk about the treatment first.
Okay, that's beautiful. Not to sound too technical, so I would categorize the treatment into three main parts. Okay, so we have treatment for the pre-cancer lesions. That is the abnormal cells that are formed after you get persistent infection with the HPV virus.
Okay.
That one has not developed into cancer yet.
Okay.
So with that one, once again, you do your regular screening and your doctors find that all you have to do is there are certain procedures, cryotherapy, we even have laser treatment. Basically, they'll just take that diseased portion and then you are fine again.
So, like, how many stages for the cancer, the cervical cancer?
Yeah,
so is it the three normal? I know of the breast cancer stages. Is it same as the cervical cancer
Yeah,
stages?
so the staging, once again, I don't want to sound too technical because I want everyone to understand. But I've grouped it according to three main, let me use the word presentations. So the first one, as I mentioned, is the pre-cancer lesion that if it's detected early, it can be treated. However, when it has developed into cancer, but it's just at the early stage. This is like cancer at the early stage. It hasn't spread all over your body, all throughout your body. That one can be treated with surgery.
Okay.
So when the cancer starts in the cervix, it may spread to your womb, that is your uterus, and even sometimes your ovaries, even your vagina sometimes. So when that's even the early part of the cancer. So when you reach that stage, the solution to that is usually surgery. So you go to surgery, they take out the parts of your female reproductive system that have been affected. Sometimes
Yeah, just
they
that
take out
part.
they take out your cervix. Sometimes they take out your uterus. Sometimes they may take out your ovaries as well. That means that if you're a young person that you are looking forward to having children, that dream has been shattered. That is even the early stage of the cancer. Then when you report very late and you get to the late stage of the cancer, and in this situation, as the patient that I saw, then the cancer has spread even sometimes to the lungs, it has spread to your bones, it has spread to your brain. And with that one, unfortunately, they can't cure you. It's not curable. So the only alternative is palliative care. That is trying to make you as comfortable as possible till you pass away from the disease. So as you can see, it's very devastating,
Yeah.
the complications of cervical cancer.
It's just that there's not so much
Noise being made about
it. Even
this.
we, the health professionals,
Exactly.
we barely, get tests for this cervical
Exactly.
cancer.
Exactly.
Who are at risk of cervical cancer? Because I know you mentioned earlier those with HPV infection, like consistent infection, right? Is there any other risk factors that?
Yes. Okay, so any high risk behavior that weakens your immune system, so smoking, there has been an association with prolonged use of oral contraceptives with cervical cancer. Yes, and HIV infection, people undergoing chemotherapy for any form of cancer.
Okay.
Yes, people with diabetes. Yeah,
So other medical conditions.
exactly. Other medical conditions
Is
that
it only
weaken
diabetes?
that weaken your immune system. Yeah, they call it being immunocompromised.
Okay.
So if you're in that state, it's sort of your body can't fight off the virus as a normal or as a fit person's body would fight.
So how do we prevent this?
Okay, so by practicing safe sex. So as I said, the HPV virus, which is the main cause of cervical cancer, is transmitted through sexual activity. So protect yourself, okay?
If you say I should protect myself, I mean
Okay,
the use of condom, because you're saying
exactly.
oral contraceptives
Yeah,
can also lead to
yeah.
this cancer.
It's just it's an
So
association, like
abstinence.
yeah. So no, I'm trying to say using a condom. So the thing is that men carry the HPV virus.
Okay.
Okay. However, they don't have a cervix, so even if they get infected, it will
Yeah.
become cervical cancer. But they can spread it to other women. Do you get it? So practice safe sex because you don't know who the other person has been with. So just protect yourself,
Okay.
and also regular screening.
Yeah.
So ideally, if you are between the ages of 21 to 65, you have to make sure that at least every 3 years,
And now
if
that
you're a
the
woman,
screenings are uncommon here in Ghana.
yeah, no, they if you see they if you find the facilities, and that's one of the things that my foundation will try and do. We want to
Okay.
try and spread awareness. We want to try and make some of the resources available, so we'll show you where to easily get
Yeah,
these things.
this.
Yeah.
Okay.
So when you find a place where you can get your pap smear done, make sure you do it every 3 years, at least once every 3 years, if you're between the ages of 21 to 65. And the other way you can protect yourself is to get the vaccine. However, the vaccine is only effective or has been proven to be effective in people who are not sexually active. So ideally, children, maybe in Western countries, children from between the age of 9 to 14 years, they vaccinate
And is
them.
there a vaccine here in Ghana?
Yeah, actually, the vaccine is available in Ghana, but it hasn't been put on any national immunization schedule. So it means
Okay.
you have to walk into a private facility and get it done. Once again, I know Marie Stopes has the
So
vaccine.
unless Mary
Yeah,
Stoops.
yes, for now, and regional hospitals and teaching hospitals. I know if you go to the Kolebu Family Planning Unit and you
Unit.
ask about it, they may direct you to
Someone.
somewhere you can get
Okay.
the vaccine. But once again, it's effective. It doesn't mean you can't take it, but it's effective in people who are not sexually active because they don't have the virus yet. Do you get what I'm trying to say?
Okay.
So the vaccine will protect them so that when they get the virus, the body will fight against it. But if you already have the virus, the vaccine won't help you as much. So ideally, if you have an adolescent girl, teenage girl, even boys in Western countries, the boys are also vaccinated to sort of reduce the load, the viral load of the HPV, because although they don't have a cervix,
Yeah,
they can spread.
spread
So if
it.
they also get the vaccine and they are protected, it will reduce the spread and
So it's not.
reduce
So people
cancer.
shouldn't assume after getting the cancer, that's where they look for the virus. It's not going to work.
You mean the vaccine or?
So when you get the cancer and you're trying to get vaccinated, that means the vaccine is not going to work.
Yes, it's not going to work because the vaccine is supposed to protect you from the HPV virus, which will later develop into cancer. Yeah,
Right.
so if you already have it, then there's no need to get.